Well, most of you know I was the shortest Surgeon General. For whatever reason, I said that we was going to talk about the things that was the greatest cause of poverty, ignorance, and enslavement in the United States. And we did. I didn't survive it, but our adolescents did. It was you. It was you in the public health service that has reduced our teenage pregnancy rate 57%. So I'm proud about that. And I'm even more proud that you know most of them, not most of them, but a higher, greater percentage of them looked like me. So I feel that I was very proud of what we did. I served under President Clinton for 15 months. I'm proud of those 15 months, and maybe nobody else is. I loved being your Surgeon General. And I want you to know I did the very best job that I knew how. And if I had to do it all over again, I'd do it the same way. Because whether you know it or not, 36% of your health care dollars is spent on sexual and reproductive health. And we don't teach about it in our medical schools. We spend 5 hours in medical schools teaching about sexual and reproductive health. 5 hours, and it consumes globally, for the whole world, 18%, and for the United States, 36% of our healthcare dollars. So you'd think that we would be more concerned. So I really feel, and I'm so pleased, you know that I worked very hard on the Health Security Act. It went up in flames, and I'm very pleased that we have the Accountable Care Act. Affordable Care Act. Some of you may not like it, but you know, we've been trying for 100 years to get a health care system in the United States. And if we don't like it, what we need to do is don't throw it out, let's fix it. And I think that that's what we should be about. I feel that we need to transform, and this is what I was saying all before, we need to transform our sick care system into a health care system. We've got the best sick care system in the world. The problem is we don't have a health care system. So I think it's time we worked on fixing that. So when I think about, I don't have a lot of reports to talk about, so you see I wasn't there long. The report on children and smoking was released while I was the Surgeon General, and we talked about that a lot, and I was very proud about that. But you know, that was truly, as Dr. Satcher said, has been going on at the CDC forever. Every Surgeon General feels very strongly and works hard on smoking. And I think we need to keep working hard on smoking until there are nobody smokes in the United States. But as I think about my vision and what the Surgeon Generals can do, or what we can do, we all healthy people in healthy communities. I think CDC, we've been saying that forever. We want a health care system that's available, affordable, accessible, and crisis responsive. It needs to be patient-oriented. You know, all of medicine is primarily, you go to the doctor and the doctor talks to the patients, but more and more, because of your push, you are empowering the patient to get more involved in their own care. And I think that's absolutely very critical and something that we've got to do. The Affordable Care Act can't be as meaningful if we don't have educated patients. We've got to educate our populace to really make a real difference. I think Thomas Jefferson said many years ago, he says, you can't keep an ignorant population healthy. And we refuse to educate our people. And that's what we've got to do. So as I think about what we need to do and what we're going to need to do in the future, is I think we need to make sure that we care enough, as Dr. Satcher said earlier, to be concerned about what's going on. We care enough that we listen to our patients, learn what they need, and lead them to where they need to go. We've not done that. We've getting more and more chronic diseases, so we've got to educate our people on how to take care of themselves. And this is what you and what we've done in public health, is teach people how to take care of themselves. We've got to reach out and be responsible. You can't be responsible if you don't know how. We've got to continue to do the same high-level research that you're always doing. And we've got to educate, 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 and empower our people to be responsible. And we can never forget our role as the nation's doctor and the leaders in public health. You're the leaders. You're the transformational leaders that will make the difference if we're to have a healthy society, rather than continuing to brag about the fact that we've got the best sick care system in the world. Thank you.
Well done.